Ever wondered why countless brilliant minds, including the likes of Vincent van Gogh and Julius Caesar, were plagued with sudden, uncontrolled bursts of electrical activity in the brain? This mysterious and often misunderstood condition is known as epilepsy. Epilepsy, a neurological disorder, has roots deep-seated in various causes. It can be a result of genetic influence where certain genes may make a person more susceptible to environmental conditions that trigger seizures. Additionally, epilepsy can stem from head trauma, such as injuries incurred during a car accident or from a fall, but it doesn't stop there. Brain conditions like strokes and tumors can cause epilepsy. Infectious diseases such as meningitis, AIDS, and viral encephalitis can lead to this condition too. Prenatal injury or damage that happens to a baby's brain while it's still in the womb can also be a culprit. Factors like poor nutrition, oxygen deficiencies, or an infection in the mother can increase the risk of the child developing epilepsy. So, what happens when a person has epilepsy? The effects of this disorder are far-reaching and varied. The most apparent manifestation is recurrent seizures, but the impact is more than just physical. People with epilepsy often grapple with psychological issues like depression and anxiety. There can be cognitive and behavioral effects too, including memory problems and difficulties with attention. Seizures themselves can range from mild to severe. Some people may simply stare blankly for a few seconds during a seizure, while others can lose consciousness and convulse uncontrollably. The type of seizure depends on where and how the abnormal brain activity begins. Preventing epilepsy isn't always possible, but taking steps to reduce risk factors can help. Protective measures during pregnancy, proper supervision of young children to prevent head injuries, and maintaining good overall health can all contribute to lowering the risk of developing this condition. When it comes to treatment, the most common approach is medication. Anti-epileptic drugs don't cure epilepsy, but they can prevent seizures from occurring. In cases where medication isn't effective, surgery or therapies like vagus nerve stimulation or a ketogenic diet may be considered. In conclusion, epilepsy, a disorder characterized by uncontrolled electrical activity in the brain, is a complex condition with a multitude of causes and effects. It's a condition that touches every aspect of a person's life, from their physical health to their emotional well-being. By understanding and spreading awareness about epilepsy, society can help reduce the stigma attached to it and promote a more inclusive environment for those living with this condition. Remember, knowledge is the first step towards change.